So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Welcome. Thank you for joining our team of students today. We will be covering a presentation about HIV treatment and prevention. We'd love to thank our student speakers today. We have Haley Harrison Ellis, L, Angela Ross, Jayashree Salian, and myself, Cynthia Cherise Murphy. We'd also like to thank our slide contributors, Bethany Smith, Katherine Aybar, Shiloh Touby, Madison Clark, and Aysha Rahman. Today on the agenda, we will be covering the introduction of HIV, definition, timeline, stage, and symptoms, the impact of HIV, healthcare and global, the 3 T's, transmission, testing, and treatment. And finally, we will head over into the resources and have some questions we'll be answering for you.
What is HIV? Human immunodeficiency virus. HIV is a virus that attacks the body's immune system and makes it more difficult for the body to be able to protect itself from illness and disease. Stages of HIV. If treatment for HIV does not happen, those infected will typically progress through 3 stages of the disease. With treatment, disease progress can be slowed or prevented. Timeline of HIV: 1981 to 1989. June 5, first report of AIDS appeared. Needle sharing identified as transmission method. By the end of 1989, 683,000 people are living with HIV. 84,200 new HIV diagnoses. From year 1990 to 1999, CDC issues recommendations for healthcare workers with HIV. It becomes the #1 cause of death for US men aged 25 to 44. 683,000 people living with HIV. 58,400 new HIV diagnoses. 2000 to 2009, Global AIDS and TB Relief Act authorizes $600 million in funding. CDC enacts new initiatives to get those living with HIV diagnosis and treatment. 1.1 million people living with HIV. 45,748 new HIV diagnoses. Between the year 2010 to 2019, CDC launches framework to reduce new HIV infections in the United States. Drugs reported treat HIV and reduce risk of infection to those high risk but negative for HIV. 1+ million people living with HIV. 37,515 new HIV diagnoses. From year 2020 to the present, PrEP medications growing in usage. New HIV infections decreased by 18% between the year 2008 to 2014. 1 million plus people living with HIV. 37,515 new HIV diagnoses. Healthcare HIV impact. Healthcare workers have the risk of catching HIV as well as other diseases on the job. It is important that all healthcare workers do the following to protect themselves. Use goggles and other protective gear when anticipating contact with blood or body fluids. Wash hands frequently and other skin surfaces exposed immediately after contact with blood or blood fluids. Be careful when handling and disposing of sharp instruments during and after use. Use safety devices to prevent needle stick injuries. Dispose of used syringes or other sharp instruments in a sharps container. Healthcare personnel who have had a possible exposure can call the PEP line for advice and help on steps to follow when occupational exposure happens. What does the global impact look like? 40.1 million have died since the start of the epidemic. In the African region, 1 in every 25 adults has HIV. In 2021, 650,000 people died from HIV-related causes. 7% of people between the ages of 15 to 49 were living with HIV in 2021. 85% of people living with HIV knew their status in 2021. Since the first cases were reported in 1981, approximately 84.2 million people have been infected with HIV. In 2021, there were about 28.7 million people receiving treatment for HIV. HIV is the leading cause of death globally as well as the leading cause of death for women in the reproductive age. According to WHO, the African region is the most affected by HIV and accounts for more than 2/3 of the HIV population. Talking about the transmission, HIV is transmitted from person to person through blood, semen, pre-seminal fluid, vaginal fluids, rectal fluids, from an infected mother to her child through pregnancy, childbirth, or breastfeeding. Transmission. You can also get HIV by sharing needles, high syringes, body piercings, also earrings, and tattoos with devices that are infected with the virus. HIV can also be contracted through a blood transfusion.
High-risk individuals. Living in communities with high rates of HIV increases the chances of exposure. Risky sexual behaviors, that is, having unprotected intercourse encounters with multiple partners, and people who inject drugs, also needle sharing. Pregnant women with HIV. During pregnancy, an HIV-positive woman may receive an antiviral therapy, ART, which reduces the amount of virus in her blood and reduces the chance of to her baby. Cesarean sections may be recommended to reduce the risk of transmission during delivery. Taking HIV medications and keeping other viral load to an undetectable level can reduce the risk of passing HIV to the baby. According to the World Health Organization, 1.3 million pregnant women have HIV globally, and 81% receive antiretroviral drugs to prevent mother-to-child transmission in 2021. What to do if exposed. If exposed, call your doctor and see them immediately. If you can, see your primary care physician or go to the emergency room and see if you can take a PEP, post-exposure prophylaxis, to prevent HIV. It must be taken before the 72-hour time frame is over. Every hour counts. Is a medication used to help those who think they may have been exposed to HIV via sexual assault, having unprotected sex, finding out that they were exposed, from needles, or accidental fluid exchanges. It is not a medicine that can be taken regularly or prescribed to a person to cure HIV. Testing also needs to happen to ensure you don't already have it before you take PEP and after. Stages of HIV. Stage 1, acute HIV infection. A high amount or viral load of HIV in the blood is very contagious, and many people will have flu-like. Chronic HIV infection, all known as asymptomatic HIV or clinical latency HIV, is still active and reproducing in the body. People may not feel sick, but can still transmit the infection. With treatment, you may not move into stage 3. Stage 3, acquired immunodeficiency syndrome, or AIDS, the most severe stage of HIV infection. High viral load may easily transmit HIV to others. People have badly damaged immune systems and are more susceptible to illness and disease. Early symptoms of HIV. Early HIV symptoms most often appear 2 to 4 weeks after a person catches the virus. The symptoms can seem like a bad case of the flu. They often include fever and chills, headache, tiredness, swollen lymph glands, rash, sore joints, muscles, and weight loss. The importance of diagnosis and treatment. According to the CDC, about 1.1 million people in the United States are living with HIV, and approximately 56,300 people are infected every year. Moreover, 20% of the population isn't aware that they are infected. Early HIV detection and treatment is important because it reduces patient mortality and prevents future HIV transmissions. The earlier you are diagnosed with HIV, the earlier you can begin treatment.
Methods of HIV testing. The first one is an antibody test. An antibody test looks for antibodies to HIV in your blood or oral fluid. The second is antigen/antibody test. An antigen/antibody test looks for both HIV antibodies and antigens. And the third is nucleic acid test, or NAT. A NAT looks for the actual virus in the blood. This is the most effective. The HIV testing results will depend on the type of HIV test performed and where you get tested. PrEP medications. PrEP medications can either be through pills or shots. Currently, there are 2 pills that are approved for daily use. PrEP medications were designed to reduce the overall risk of HIV from a sexual encounter or infection drug use from someone who is HIV positive. Speak with your doctor right away if you feel like you could benefit from these medications. As I mentioned, there are the 2 different forms. There are pills. There are 2 options, which are Truvada. It's used by all people at risk for HIV through both sex or injection drug use. The second is Descovy, designed for sexually active med and transgender women at risk for getting HIV. And Descovy is not for people assigned female at birth. And then there's the shot, which is Epritude, administered every 2 months by healthcare providers to reduce risk of HIV through sex. HIV prophylaxis. PrEP is pre-exposure prophylaxis. PrEP medications are designed for high-risk individuals for contracting HIV. It is highly effective at preventing HIV. It reduces the risk of getting HIV through sex by 99% and reduces the risk among people who inject drugs by at least 74%. Prophylaxis methods. Prophylaxis measures are also known as preventative measures. HIV prophylactic medications will only help to prevent the risk of contraction. Treatment of HIV. There's the antiretroviral therapy, or ART. It is a treatment used to control the progression of HIV infection in the body. It consists of a combination of medications that target different stages of the HIV replication cycle. The goal of ART is to suppress the virus so that it cannot replicate and damage the immune system. Classes of antiretroviral drugs. There are two main classes used in ART. They are nucleoside reverse transcriptase inhibitors interfere. They interfere with reverse transcriptase enzyme necessary for the virus to replicate. The second is protease inhibitors, or PLS. They block the protease enzyme required for the virus to assemble new viral particles. The fight against the HIV epidemic. A major effort was made by the U.S. to contribute globally, and it was introduced in 2003. The U.S. President introduced a plan called the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, which has been the largest commitment made by any nation to combat a specific disease. There are many organizations that are assisting to combat this epidemic. An organization that can be recognized is the Peace Corps, which volunteers worldwide to help communities develop healthy behaviors. Resources to locate testing and treatment. The first is gettested.cdc.gov or 1-800-CDC-INFO. You can also contact your local health department or ask your primary care provider. You can visit hiv.gov or Ryan White with the HIV/AIDS program. There's ada.gov/HIV. You could call or text 988. And lastly, you could visit your local pharmacy.
Thank you so much. That was an amazing rundown of all the slides that our phenomenal students have prepared. So now we are going to turn our cameras on and head over to the discussion side of things. So we will be covering our first question here, which is, why is HIV prevention important? High-risk individuals that test negative for HIV are eligible for preventative medications. These medications will help stop new HIV infections. Preventing new HIV infections will, over time, reduce the number of people living with HIV. Does anyone have anything they would like to weigh in on that? Jayashree.
With how we just read the rate at which it spreads, I guess it makes completely it makes sense to get checked to prevent the new infections, because the number of diagnoses also have been the numbers have also been large compared to how it started. So I think to prevent the new infections, it's important to get checked.
Yeah, I also think it's important just based on the fact that we can't tell people not to participate in high-risk activities, especially, um, we know that HIV is prevalent and we know that it exists and we know how it spreads. So providing medications for people who participate in high-risk behaviors allows them to continue their lifestyle without furthering their risk for HIV. So I think it's really important. I don't think we can hear you, Cynthia.
Oh, okay. So sorry. Thank you so much. So yeah, those are some great points you guys bring up, and I do believe on the prevention side of things, doing your due diligence and practicing safe sex, and just being aware of the potential. There's numerous ways to get HIV, so I just think keeping that in mind and taking those safety precautions. Angela, were you able to get your camera or at least your audio working? Did you want to weigh in on that? Okay, so there's Angela. We can see her. Can we hear her? All right. So for the second question, we have, how can you prevent HIV? I did kind of cover that in advance. Practice safe sex and have conversations with your partners before sex. Do not share needles and or syringes with others. Avoid places that practice bad care. For example, a dirty tattoo parlor or a friend using the same needle or tattoo with multiple people. What do you guys think? Jayashree?
Yeah, here I would like to highlight the fact that, yeah, these are definitely some of the ways to prevent HIV, but then also when it comes to, educating younger population, I think, this topic should be a part of their education. Recently, when I was finishing my master's, we had to develop a program for a school, for high school children, and we made sure that we include this topic because that's the age when the kids, they involve into sex and they try to explore different sexes. So it's important for them to know what is right and what is wrong, and these are like very small things, but educating them at the right time can bring a lot of precautions, and they'll be you know uh, they'll, how do I say it? They would not involve themselves into risky behaviors.
Absolutely. Thank you so much for sharing. Angela, did you get your audio working?
I think so.
There we go. Awesome. What do you think, my dear?
Well, I kind of missed what everybody else said, so I don't even know if this topic was already brought up, but I guess I'll just say it again. When we were discussing the prevention and places to avoid, I actually work in a tattoo parlor, and I cannot stress enough, go to a reputable tattoo artist. Go somewhere where they have done their bloodborne pathogens certificates, where they use only disposable needles. That is one of the best ways, especially with more and more people getting tattoos and piercings. Go somewhere reputable.
Absolutely. Thank you so much for sharing that. Haley, what do you think, my dear?
Yeah, I completely agree with what Jayashree and Angela said before. We know that HIV is spreading, so the best we can do is implement education and do our due diligence, make sure we're researching and aware of how it spreads to prevent ourselves and also to help the people around us prevent the spread of HIV. So I liked what Jayashree said about increasing the education for students who are more likely to participate in high-risk activities, so they can at least do it in maybe a more educated way. I mean, we can't say that they won't participate in the high-risk activities altogether, but they may step back, think for a second before maybe they have their friend tattoo them or something like that. And then again, just making sure that we're all aware of what we're doing and how we're doing it and trying to do it the safest way possible.
Thank you so much for sharing that. I remember in school when I was younger, I actually had to fight my mother on getting a permission to go into sex ed, and so at an early age, I think middle school, I learned about these kind of diseases, HIV, and I just became super, scared and aware that I didn't want to like share my body for one. Just wanted to be respectful of myself, but for two, I was like terrified of getting HIV or something, through that kind of, um, you know, sexual contact. And then, you see some of these crime shows where, there are, men going out and having unprotected sex, knowing that they have HIV, and some kind of mental illness in that of them being proud and going out and spreading that. So always just, safeguard yourself and, get testing before you decide to have intimate intercourse. So that's all I would like to add. So let's go ahead and go. This is great, you guys. You guys did a wonderful job on this presentation. So the third question is, what are myths about HIV? A person can get HIV from hugging a person infected or by general touch. HIV is only found in gay men. It is okay to have unprotected sex with HIV if both partners have it. Birth control will prevent HIV exposure. Now, keep in mind, these are myths. Jayashree, what do you think, my dear?
Yeah, I think like along with the myths, there are so many taboos around HIV. Like I come from India, wherein, talks about sex especially is not encouraged and is not talked openly. So with that kind of population, it's very challenging to educate them or to spread awareness. And people, I've heard so many silly things around HIV, like people can even die if they have HIV, like immediately as soon as they are infected, but that's not true. So I think, again, I can't stress enough on how important education is when it comes to these things. And also, various platforms that can act as the right platform to educate and to spread the right information.
Thank you so much for sharing that. Angela?
I don't know that I necessarily have anything to add to that one.
Okay. Haley?
Yeah, I mean, I was just going to add that understanding what is true and what is untrue about HIV is incredibly important when we're talking about how it spreads, just so that people who are both positive for HIV and who are not positive for HIV are aware when they're participating in any activity that increases their risk. And it's also important to consider where people are getting their information. So making sure people are finding information about HIV on reputable sites, maybe making it more accessible to high-risk populations. And we also need to acknowledge that having a base understanding, so back to that education point, having a base understanding about what HIV is, how it spreads, and how it doesn't spread is really important, just as a foundational knowledge before we send kids out into the world to just experience life. If they have this base understanding of HIV, I think they would be less likely to participate in high-risk activities, but there would also be a little bit of lower fear associated with HIV. Yeah.
Absolutely. Thank you so much for sharing. I had a unique experience when I was about 8 years old. I went out to Kentucky and visited with my 8 uncles and my aunts. And one of my uncles was dating a woman with HIV, and she had reached into the freezer and got ice out of the freezer. She used the bathroom, and my aunt started freaking out. They emptied out the ice tray. They poured bleach all over the bathroom. And, just knowing that not only was just kind of disheartening and disrespectful, because, that's not a way that you can contract HIV. So I definitely think the awareness out there and just knowing the type of precautions to take and not having those misconceptions is helpful, just for understanding the nature of that. So I just wanted to share. Okay, so we have one more question. How can you help someone who is HIV positive? Knowing about HIV is an important step in supporting your loved one and reassuring them that HIV is a manageable health condition. It can be helpful to an intentional listener and a reliable friend or family member to fall back on. Encourage them to start HIV treatment as soon as possible. Provide help to establish and maintain a medication routine. Jayashree, what do you think?
Yeah, of course. I mean, if you know someone who is HIV positive, the only thing you can do is not scare them and maybe give them the right uh, uh, information and the right places to access what to do and how to get tested and how to go about this whole thing. And I think these, like as public health professionals, the campaigns that that are run in the rural areas, they also try to make these information make this information available to people. So I think that also is one of the ways to help someone, or because I think people from the rural population, they are unaware because of their education and their literacy rate. So it's important for them, for us, to go out and educate and be a part of such campaigns to help them.
Thank you so much. Angela, did you have anything to weigh on for final concluding remarks?
Yeah, I think anyone facing any kind of a chronic illness is also going to have effects in their mental health. So encouraging them to have someone to talk to, and to get help in supporting them emotionally and mentally while they're dealing with this is going to be very, very crucial to how they are able to stay on top of their routines and their treatments, and encourage them not to give up. This isn't the end, and to just really support them mentally and emotionally.
Thank you so much for sharing that. Haley?
Yeah, I think first and foremost, you need to create an environment where your friend would feel safe and comfortable coming to you with an HIV positive diagnosis. And then additionally, I think you also need to educate yourself before you can educate someone else. But you can, even before providing them with information about HIV, you can still be a safe person for them to talk to, somebody that they can bounce ideas off of. And then you can also encourage them to seek more medical treatment or a second opinion, and just lead them in the right direction the best that you can, while also educating yourself and making sure that you aren't making them feel ashamed or increasing their fear, or anything like that that would make them feel uncomfortable, feel unsafe, or just scared in general.
Thank you so much for sharing. This has been such a great presentation with all of our students. You guys did an excellent job preparing the materials, covering the slides, and raising that public health awareness around the topic of HIV. So thank you, everyone who's tuned in to join us. And thank you to all of our students here, Angela, Jayashree, Haley, Kyle's been on the back end. And we will see you guys next time. Bye.